Now this is an ultrasound of a female, aged 40 years, with the complaint of burning micturition and incomplete evacuation of the urinary bladder with loin pains bilateral. Now you will rarely see such an image. That is, this is the urinary bladder in transverse section. This is also urinary bladder in transverse section on the left side. And here you see that there is a calculus measuring approximately 5.9 millimeters or 6 millimeters in the left uretrovesical junction, and it gives posterior shadow. On the right side of the image you are seeing dilated. This is the dilated uretrovesical junction, and you see this area. There you see a calculus that measures approximately 9.4 mm in the dilated uretrovesical junction. Now let me reproduce this to you on the ultrasound. Now this is the right side of the this is the urinary bladder in transverse section first of all, and let me tell you that these two eyes that you are seeing, small one, and this is the second one. This is on the right side, this is on the left side. These are dilated ureters, distal ureter, and this is the urinary bladder in transverse section. See, when I maneuver the probe, this is the dilated right ureter, and when I move the probe towards the left side, you will see the longitudinal section of the dilated ureter, left ureter. This is the dilated left ureter, and in transverse section I see this is the calculus. Now this is the calculus giving posterior shadow in the you see this is a bulge from the left uretrovesical junction. So this is the cause of obstruction in this area. And on the right side, first of all, see that the uretrovesical junction is protruding into the urinary bladder. This is the area is being cut off, but it is a dilated uretrovesical junction, and here is the calculus. This is the calculus in the right uretrovesical junction. This is the urinary bladder, and here it measures 9.1 millimeters. Now, having seen this, the calculi in both dilated uretrovesical junctions, this is the dilated uretrovesical junction, this one, this area on the right side, and this is the dilated uretrovesical junction, and this is the calculus impacted in this area. This is a post-void ultrasound. Let's see what is the post-void residual volume. Calculated residual volume is simply, this is an approximate volume, and it's approximately 497, means 500 plus is the urine within the urinary bladder, and this is significant. Let's see the kidneys. Now this is the right kidney. Yeah, I'll show you the right kidney first. Yeah, this is the right kidney, and you can see that the right kidney shows dilation of all the calyces. This is the upper pole, liver, this is the upper pole, and these are dilated calyces, minimal to moderately. And here you will see that the pelvis is dilated, the proximal ureter is also dilated. This is the renal pelvis. Here is approximately 3.8 centimeter, and this is the proximal ureter, measures 10.3, and we know that up to 7 is normal, so the proximal ureter is also dilated. Now these are the lower pole dilated calyces. This is the parenchyma. Parenchymal echogenicity is normal. These are the pyramids. Corticomedullary differentiation is intact. The thickness of the parenchyma is intact. Now on the left side, सीधे हो जाओ पासा मेरे लिए जी मेरे बस. This is the left kidney. The upper pole is in front of you. This is the upper pole, mid region, the lower pole. Now you see that there is dilation of all the calyces, upper, mid and lower. And this is the parenchyma, normal parenchymal echogenicity. Thickness is normal. These are the medulla. Corticomedullary differentiation is intact. No calculus seen within the dilated calyces. This is the spleen. And the proximal ureter in this region, in the left kidney, does not show that much of a dilation that we saw in case of right kidney. This is the proximal ureter from the pelvis, and here it measures only 5.6, it's less than 7. Here the proximal ureter is not dilated. So there you go. Now coming back to the reason for the urinary bladder outlet obstruction in this patient under study is bilateral calculi in both the uretrovesical junction. This is the which are preventing the flow and the back pressure into the leading to hydronephrosis. It causes this in the right uretrovesical junction. This is the dilated this is dilated left uretrovesical junction. This is the dilated right uretrovesical junction, and there is a calculus in the innate area. It's protruding, this uretrovesical junction is dilated, protruding into the urinary bladder. This is the calculus. There is no wall thickening. The anterior wall that you can see is now thick. No hypertrophic trabeculae are seen. This is a magnified view. So this is the uterus is normal, rest all of the parameters are normal. Thank you very much. This is our case of today.